My name is Richard Hewitt. I am a consultant pediatric ENT surgeon. Good question. I wanted from the age of 2, I was one of these annoying kids who knew what they wanted to do. I wanted to fix people, which I initially thought was becoming a doctor. My parents are not medical at all. No one in my family is, and it was not a popular decision. They thought I would work too hard for not enough money, I suspect. So they made me do loads and loads of work experience. Well, made is a tough word. I thoroughly enjoyed it, working in hospices with the GP practices, work experience in hospitals, and everything I did made me want to do it more. I learned through my teens and observing in various hospital environments that I was much more, I enjoyed much more the surgical aspect of something, seeing a problem, fixing a problem, and then having someone or be fixed who then goes off and doesn't have that problem again, rather than the more medical way or managing problems through the lifetime of a patient approach. And that's how I sort of fell into surgery. So I've always had a great affinity with children. Obviously, I was one, which was helpful. And I've always, it's been a patient group I've always enjoyed treating, got on well with, and related to. As from an ENT point of view, well, I did my higher specialist training in ENT because I loved head and neck anatomy. Obviously, then I extended my role doing neurosurgical training and cardiothoracic training so that I could extend my head and neck skills for skull base problems such as cancer, and also for airway problems where the windpipe disappears into the chest, and so that I was in a position to operate in those fields as well. I was lucky in that the interests I have are really only possible to combine in children, and also only possible to combine really at Great Ormond Street for the more complex end of management. And I was fortunate enough to be able to work there, and that's where I am now, obviously in private practice outside of Great Ormond Street as well as at Great Ormond Street. Well, I really love people and kids, which is great. So it's really wonderful that I get a new person to chat with, play with, help all the time, and that's really enjoyable. I like the camaraderie of the hospital, the team approach to helping and providing care, and there's been so much more emphasis on that rather than someone running a show, everybody having an important role, and that's had such an important reflection in the outcomes we now get, certainly with the more complex surgeries and complex conditions. So I really enjoy, not so much, the self-satisfaction of fixing someone, but more the interaction with patients before, the gaining their trust, and then, seeing them do well afterwards. I think you probably have to ask my patients that. I'm very available. I'm like lots of people who are attracted to surgery, it tends to dominate my life a little bit. So hopefully I am always available to the patients. I'm informed. I'm a good communicator with children, and it's such a key to be able to get the children to relax. I mean, they're not going to find it like home, but to be able to let them not be scared stiff, and also not create a child who's scared stiff to see a doctor ever again. So I suspect that would be it. So, well, one of the great things about pediatrics is, us adults, we are difficult, complex creatures. Children are not. Children are relatively simple. They want to trust somebody. You have to earn that trust, not break it, but they want to. They want to get better, and the physiology of a child heals so well in comparison to an adult. They've not poisoned themselves with various means, alcohol, cigarettes, these sort of things. And also they do get better really well. They recover from a lot of the operations we do and a lot of the info things in such a more simple fashion, not only mentally, in that they are not forever asking themselves how they're feeling like us adults are, but also physiologically they heal much better. So I think that would be where I would value my patients. Also, they're a lovely group to treat. I am a relatively fun person and quite mischievous, and children definitely echo that, and I thrive with that in that environment. It's a good question. I have lots of mantras. My wife and my children would tell you I have many rules that I set myself. Some of them are a little more didactic than others. I certainly have always subscribed to, if I work harder than anyone else, I will do the best that I can. I suppose there's a mantra for how I treat patients. I mean, obviously, as a surgeon, we often get presented with situations where there is a surgical option and a non-surgical option. And so I suppose my mantra is I try and think what, as a parent, an informed parent as I would be, I would do for my children in these situations. And that is a philosophy that has served me very well in the management of children over the years.